to make. That comes after a meeting of our emergency team that was meeting today. So my fellow Kenyans, on Friday, March 6th of this year, the government of Kenya received confirmation of the first case of COVID-19, more commonly known as coronavirus. As you may recall, when we first announced the confirmation of the first case, we did state that we had traced 27 persons who had come into contact with the first patient. We have since tested all 27 people at our National Influenza Center, and today we have received confirmation of 2 more cases of the coronavirus. The 2 have tested positive as a result of coming into contact with the first patient. Our health officials have already moved them into Kenyatta National Hospital isolation facility. The medical teams are closely monitoring the patients who are reported to be in stable condition and responding well to treatment, and this indeed gives us hope. Fellow Kenyans, my government has been working to monitor the spread of this virus, and we have set up necessary containment and treatment protocols across the country. However, following the results of the 2 additional cases, we are now, this evening, directing the following additional protocols. Number 1, the government is suspending travel for all persons coming into Kenya from any country with reported coronavirus cases. Number 2, only Kenyan citizens and foreigners with valid residence permits will be allowed to come in, provided they proceed on self-quarantine or to a government-designated quarantine facility. This will take effect within the next 48 hours to cater for any passengers who may be en route. This directive will remain in effect for the next 30 days or as varied by the National Emergency Response Committee. Number 3, all persons who have come into Kenya in the last 14 days must self-quarantine. If any person exhibits symptoms such as cough or fever, they should present themselves to the nearest health facility for testing. Number 4, we have suspended learning in all our education institutions with immediate effect. Consequently, and to facilitate a phased approach, primary and secondary day schools are to suspend operations from tomorrow. For those in boarding schools, the school administration is to ensure that students are home by Wednesday, the 18th March 2020, while universities and tertiary institutions are to close by Friday, 20th March 2020. Where possible, as number 5, government offices, businesses, and companies are encouraged to allow employees to work from home, with the exception of employees working in critical or essential services. Number 6, in order to avoid the risk of transmission through physical handling of money, we encourage the use of cashless transactions, such as mobile money, M-Pesa and otherwise, and credit cards, and we appeal to mobile operators and banks to take note of the situation that we are in and to reduce the cost of transactions during this period. Number 7, in line with the directive to avoid crowded places, citizens are encouraged to A, avoid congregating, including in places of worship, B, minimize attendance to social gatherings, including weddings and funerals, and restrict the same to immediate family members. C, we call for people to avoid crowded places, including shopping malls and entertainment premises. And D, to minimize congestion in public transport whenever possible. And lastly, E, the limitation of visitors